put on the headsets. Did you hear us? Okay, good. It's difficult to judge when we cannot hear ourselves, so you need to have the headsets on. So welcome everybody. It's my pleasure to welcome you to this session on boosting mental health for a resilient European population. The various crises we have been going through over the last years have really challenged the mental health of the European citizens. Research stemming from EU-funded projects have already delivered a variety of solutions, from interventions at the workspace to those improving resilience in the young, to clinical guidelines in the medical area and therapeutic experience in areas like the arts and culture. In this session, we will learn how research can answer the needs of policymakers to develop effective strategies to boost population mental health. And the example that will be taken up during this session is the promotion of mental health at the workspace, which aligns well with one of the flagship initiatives of the 2023 Commission communication on a comprehensive approach to mental health, namely on combating psychosocial risks at work. This topic was also very much the theme of the recent conference on mental health and work of the Belgian presidency of the Council of the EU held earlier this year. With this session, we hope to provide some food for thought regarding the development of a research agenda for the expected future European Partnership on Brain Health, which also covers mental health. This EU-supported partnership will be led by member states, and it is expected to start early 2026, and preparations are already ongoing. The session is very ambitious. We have 3 speakers presenting, and we also will try to cover some questions and answers, all in 30 minutes. So I will be very strict on the timing for our speakers. And the first speaker is Professor Elva Arendsman, and she is the head of School of Public Health at University College Cork in Ireland, and she is also a professor in public mental health. She has conducted research into a wide range of topics relating to suicide, self-harm, and public mental health. She is also the vice president of the European Alliance Against Depression, past president of the International Association for Suicide Prevention, and she's also advisor to the WHO, the World Health Organization. She's also the coordinator of an EU-funded project called MENTUP, Mental Health Promotion and Intervention in Occupational Settings. And she will now present some of the key findings and project and its outcome. So over to you, Ella. We see you online.
Yes, thank you very much for that kind introduction. And my apologies that I cannot be with you in person, but I'll do my best to give a very clear overview of this MENTUP project. I will give a helicopter overview because I have only 3 minutes. So the MENTUP project stands for mental Health Promotion and Intervention in Occupational Settings, funded by Horizon 2020 and just completed last December after 4 years. But we're determined, also on the basis of our findings, to continue with the MENTUP Hub that was built for workplace settings based on a sustainable business model. Next slide, please. Yeah, so this is a large consortium comprising 18 multidisciplinary partners in 11 European countries, and we were fortunate to have Australia and the US also on board, and this really constituted a very interdisciplinary consortium with all the required expertise. Next slide, please. So the main project aim is for Mentop to improve mental health in the workplace by developing, implementing, and also evaluating what we call a multi-level intervention targeting mental health difficulties in the workplace. And the second important objective was to reduce depression and suicidal behavior. As you can see, we're targeting specific workplace sectors, healthcare, ICT, and construction. And the important rationale behind it was the high levels of absenteeism, but also the high levels of burnout and the high levels of mental health conditions. So it was a very targeted approach. Next slide, please. I here show you the systematic approach of us answering the many objectives and thereby building what we call the so-called online Mentop Hub, which comprised of 3 important evidence-based components. So sessions to reduce stress, burnout, improve well-being, and reduce depressive symptoms. We refer to non-clinical mental health conditions. And then also interventions targeting the more severe depression and anxiety, and a cross-cutting resource in addressing reducing stigma related to mental health. We did a 6-month pilot to test the so-called Mentop Hub, we followed by optimizations, and then we did the large-scale cluster randomized control trial in 9 intervention countries, which has now been concluded. Next slide, please. With the Mentop Consortium and building the Mentop Hub, we went through some turbulent times because we were still meeting in person in early 2020, then had to transfer everything online due to COVID, but also we learned a lot during COVID of how the Mentop Hub could be of use, could be relevant during times of such a public health emergency. So we're very pleased to have made it with this very great and resilient consortium. Next slide, please. So the development of the Mentop Hub is based on several important pieces of evidence, large-scale consultation amongst immediate stakeholders in workplace in the specific workplace settings, also a number of systematic reviews, and we also had an international advisory panel. So with all these inputs, we built the modules, the resources in a very interactive way because we were confronted with COVID. So we originally had hoped that the Mentop resources could be blended, but with COVID, we had to transform everything online. However, we kept very, very interactive sessions and approaches within the Mentop Hub. Next slide, please. Here we see the landing page of the Mentop Hub, which consists of more than 80 resources, generic, but also tailored to the 3 different workplace settings, and with a great variety of interactive resources and sessions for people to conduct when they access the Mentop Hub. Next slide, please. In summary here, I show you the complex design. So this was the cluster randomized control trial across the 3 workplace sectors, but involving 9 intervention countries. And in each intervention country, there were intervention SMEs, small, medium enterprises in the relevant health sectors, and control SMEs. And I'm very pleased to say that of the 67 SMEs invited, 62 SMEs remained during the intervention, which took 9 months, up to the 9-month follow-up, which I think is very encouraging to see and certainly addresses a certain need. And finally, I would like to quickly show you some of the key results here. And this is just a snapshot of the summary. But if you think back of the key objectives, then we're very pleased to see that there was a positive trend comparing the intervention SMEs to the control SMEs in terms of showing a positive effect on reducing depression, anxiety, reducing burnout, reducing stigma and improving well-being. We also had a lot of learnings in terms of how to implement such an online hub in the workplace setting, because we did focus on that the employees would be able to conduct and access the hub whilst in the workplace. So not evening time, but integrated in the work setting. We are still in the process of completing the final publications and also determining the cost effectiveness, which will deserve or have its own publication in its own right. And finally, I'm happy to share this presentation, but over the course of the MenTop project, we have at least 12 peer review publications, which also underlines the quality and the rigor of how we implemented and evaluated the MenTop Hub in these 3 key workplace sectors. Lastly, we have a huge amount of lessons learned, and I cannot share everything with you. But one of the key learnings is that based on the effectiveness of the MenTop Hub, we feel very encouraged to see how can this MenTop Hub be tested in other workplace settings, but also how can we verify the use of using this during times of unprecedented public health emergencies. So that would be a next step for us to explore. And lastly, you will here see a brief testimonial of how the MenTop Hub was embraced by an ICT company in Finland. So thank you very much.
MenTop is a EU-funded, Horizon 2020 funded research project that looks at how we can improve mental health in the workplace. And Dreambroker have been with us to pilot our intervention.
Dreambroker is a fast-growing software and technology company. We want to take a good care of mental and physical health of our employees.
We started using MenTop on a regular basis. First we started with the surveys for both employees and leaders. For 6 months we read through the materials on a weekly basis, individually or in teams, and then we had the final round of surveys where we could answer how we felt about the experience.
Okay, thank you so much, Ella, for that inspiring talk and also showing us some concrete results. We will now move to the second speaker in this session, and this is Elke Gyllebert. And she's a policy advisor on health promotion and early detection for the government of Flanders in Belgium. And she also works in the Department of Care. She leads the policy initiative Building Mental Health Together, an integrated policy framework for more mental health promotion in Flanders. And she will present this policy framework aimed at strengthening preventive mental health care. And she will also go into the need for research in developing evidence-based policies to improve mental health. So, Elke, over to you.
Thank you. I am Elke Gyllebert. I am Elke Gyllebert. So I work for the government of Flanders, the Department of Care, and I am a policy advisor on mental health. In this session, I will go into our plan, Building Mental Health Together. I'm sorry I don't have the framework yet because we're still in the making of, but I will try to go through the entire process with you. So the escalating pressure on mental health in Flanders, fueled by economic uncertainty, COVID-19, the wars, the fear of effects of climate change, an overwhelmed healthcare system, therefore the urgent need for better prevention and effective policies, kick-started this process 1 year ago. In Flanders, we're pushing for change from quick fixes into long-term solutions. Hoping this plan will guide our future government in making policies and investments with a focus on the importance of having a complete vision for the complex issue of mental health and working together with other sectors. So this is a three-staged policy development journey. So the first stage was an exploration phase that was last year. We established a scientific foundation that we could use through the entire process of this project. The second stage, and it's also this stage, is the iteration phase. And now we are refining and prioritizing the policy through participation. The third stage is the validation stage, and that's next year. Next year, we will integrate this, the policy into a new health objective. So in the iteration phase, and I was hoping that I could read it, but even at 32, my vision is declining. But I'm developing a scientific, substantiated, supported, and thank you, and measurable policy plan for mental health promotion that responds to the needs and challenges in society. The second objective is laying the economic and scientific groundwork for future health economic evaluations of interventions for mental health. And then the third, but certainly not less important, is achieving a clear division of roles and qualitative collaboration among the involved stakeholders, partners, and policy domains. So this is actually a slide I could talk very much about, but we have 3 minutes, so I will just say the most important things. We are working together with numerous stakeholders. The plan is supported by the Research Support Center for Family, Public Health and Well-being, consisting of Flemish universities like KU Leuven and University of Ghent, along with an expert panel consisting of scientists from various Flemish universities. They're all experts in mental health or diverse target groups or other populations. We also receive support from Over de Muur, that's something in Flemish, it's over the wall, for consensus building. Over the Wall supports and advises us in how to establish a good network across multiple disciplines, sectors and policy domains. I think you agree with me that's not really that easy to do. And as I said, last but not least, over 60 stakeholders, including interest organizations, interest groups, terrain organizations, are engaged with us to ensure a citizen-centered approach guided by the expert input and the research support. And this will not really... I can see it's my... former presentation, but that's okay. I was going to show you the 60 logos, and in Flanders the people say, whoa, because it's really a lot of Flemish organizations that never wanted to work together before, but now we really see the sense of urgency and we want to work together. So I think the most important slide for this presentation is the utilization of research for effective and substantial development of a plan. And why? I think it's, everybody knows, it's objective, it's effective, it's efficient, and it's transparent as a policymaker. But how are we going to do it? I told you a few examples, but I think it's the phased approach that we did. It's the exploratory phase was a real comprehensive study of relevant and current international studies. And then we did quite a big synthesis of the relevant concept and good practices. And then the initial formulation of a good substantiated vision and strategic objectives. And then the next was the participatory stage, but we constantly do the cycle scientific research, stakeholder input, and then again scientific research. And that's how we gather target input, but then we challenge it with the scientific evaluations. So now we, throughout the entire process, we do literature reviews. We do the central question. One example is, what are the evidence-based practices to promote mental health and prevent mental health problems during the first 1,000 days? Children, youngsters, adults, and elderly. You can see we're going to do the life course approach, something that is widely recommended in the WHO, but also other policies. And then an additional question we're going to have to research is which practices are cost effective. That's really important for a government, that when you do something, it's the best thing to do. And we're also going to make an intervention, a framework for health economic and health impact evaluations in the future, so that we can do it really good in the future. So that's really something very important for us. Then last but also not least is that we promote collaboration also in an evidence-based manner. We have a professor in social work, and he helps us have what are the good building blocks for collaboration, and it's also really a good process, and good that we have him on board, so we can really talk about how are we going to collaborate and what is important for a good implementation of this plan. So first results. Sorry, no time. It would have been nice to show you the first results, but we only have 3 minutes. But more on that over a year. So thank you very much.
Thank you so much, Elke. And that was interesting to see how you engage with the whole ecosystem, and also you go, through research, engaging citizens, and also straight into policy making. So thank you for making that very clear. So last but not least, we have Tomislav Sokol, who is a Croatian politician serving as a member of the European Parliament under the group of the European People's Party. He is the vice chair of the Committee of the Internal Market and Consumer Protection and a member of the Subcommittee of Public Health. And he has been the ENVI rapporteur on the European Commission's proposal of the European Health Data Space. And he is also a strong supporter of the MEP Alliance for Mental Health, a European Parliament interest group on mental health, well-being and brain disorders. So Tomislav, over to you to give the European Parliament's perspective on how to improve mental health.
Thank you very much. Thank you for inviting me. I really don't have a lot of time. I'll try to be fast. So healthcare was traditionally a marginal issue, marginal topic in the European institutions, but that has changed. That has changed primarily because of the COVID-19 pandemic, which has also specifically highlighted the problems of mental health, especially mental health of youth. I come from an educational sector. I teach at university. I was a deputy minister of education in my country, and we know how much the problem of lack of social interaction, online education, etc., really emphasized consequences in terms of mental health, especially for young people. And this is what created the momentum, political momentum, to do something on EU level. Of course, this is not the only problem with mental health, but this was something which kick-started the political interest, let's say, in mental health. So we put a lot of pressure on the European Commission to come up with a strategy, and finally did, as was already, I think, mentioned in 2023 with the communication, which is, I would say, a first comprehensive strategy on mental health on the European level. And when I mean comprehensive, so it has concrete flagship initiatives, concrete objectives, but also concrete funding, more than 1.2 billion euros, which is definitely a big step forward. When we speak of mental health and European Union, obviously we have to say that healthcare is primarily a national competence. So, for instance, which medicines will be provided and paid for by national health insurance, how the network of healthcare institutions will be organized, that's a national prerogative, but European Union can help, can provide support, can provide additional funding, can fund research, which is extremely important, and can also provide best practices, share best practices, guidelines, etc. So when we speak about about concrete things, so I would emphasize the capacity building initiative. So that's part of the plan. Also strengthening the ecosystem on brain research, which is obviously very closely connected to mental health. The suicide prevention initiative, which is extremely important, that was also mentioned in the first presentation, and also tackling stigma, which is one of the issues that is maybe not mentioned that often, but is extremely important for people who suffer from mental health issues. I would also emphasize that due to the Parliament, also healthcare is one of the main priorities in the Horizon program. So cluster 1 of Horizon is for health research, and there is a lot of projects now going on which relate to mental health. So as I said, within this area of providing support and helping member states, funding projects, research, helping strengthening capacities, etc., I think in that area Europe has now started to do much more than it did before. But of course, apart from this initiative, apart from this communication and all the measures that will be implemented, from the point of view of research, I think the most important initiative is European Health Data Space. Because health sector is the sector which creates the biggest amounts of data, but it's not utilized, it's not systematized, it's not cataloged, and it's not shared between member states because of lack of interoperability, common standards, etc. So the idea of European Health Data Space is to change this. So in this area of so-called secondary use of health data, the idea is that all of the data sets that are now lying around, let's say, unused in hospitals, in research institutes, in universities, will be cataloged, systematized. These catalogs will be made public. So, for instance, if there is some kind of a data set which can be on brain disorders, for instance, in the hospital in Berlin, a researcher from Paris will be able to make a request to the Health Data Access Body in Germany to access this data, to do research on this data, and get much more information than was available up until now. Of course, it's important that we also protect the patients and the right to choose and the right to privacy. This is why when we speak about this data for secondary use that will be made available across the Union, that this is anonymized and pseudonymized data. So this is something which is very important, that it cannot be used to re-identify individual patients. And we also provided, as European Parliament, the right to opt out. So the right to opt out if somebody does not want his or her data to be shared within this common European system, they can decide to do so. Also, that's the so-called secondary use, but also European Health Data Space is important in the area of primary use, because essentially the idea of European Health Data Space is that all of our data will be digitalized, put in a common European format. And when we travel abroad, or when you travel, for instance, from Flanders to Wallonia, you have to see a doctor. They will be able to access your health data and see whether you are suffering from some diseases, some brain disorders, mental health conditions, and provide you the best possible treatment within a much faster time without duplicating tests, diagnostics, etc. What is also important here is that patients will be in control over their data, which means that, for instance, if you don't want that your mental health disorder is seen by all the healthcare professionals who treat you for other diseases, you will be able to make such a restriction and say, I want only my psychiatrist, for instance, to see the data on my mental health, but not anybody else. So in that way, we are also protecting patients' right to choose and the right to privacy. So we are trying to strike the right balance. So to stimulate on the one hand, to make it easier for patients to access healthcare when they travel in these cross-border settings. There's a so-called primary use of data by healthcare professionals, but also to make much bigger amounts of data available for research across the European Union. And I think for mental health, which is one of the maybe areas where we have the biggest potential of further research, is definitely the area which can benefit the most, very much from this.
Thank you so much. And indeed, the European health data space will be really groundbreaking and really bring us forward, I think, leaps and bounds in terms of processing research in the future. Time is running, but I hope that we still have time to do the Slido question. So could you put up the Slido on the screen? So could you please go in there? And then you will see a list of topics that we see as research priorities, potential research priorities. And if you could choose 3 of those, the top 3 of those, please. And while you do that, I will ask the panelists very, very quickly, because we're so running out of time, just for one area you think is the most important area to do further research into mental health. Tomislav, I start with you.
So area to do the research.
To research. Oh. One area.
Yeah.
Rapid.
It's
elevator pitch.
It's not easy. I think in general brain. I think brain it's very connected with mental health and a lot of untapped potential there. So definitely research into brain disorders, where how brain is functioning, as a necessary prerequisite also for further investment, further research in mental health.
Okay, thank you, Elke.
I think the effectiveness of preventive interventions. I think that is, for me, most important that we can use for policy making. That's, I think.
Okay. And Ellen, you're still with us? What's your top priority?
Yes, it's hard to choose of the many, but if I have to choose, I would say a stronger focus on evidence-based mental health promotion interventions for relevant workplace settings in increasing preparedness during public health emergencies.
Thank you. And I'm afraid we cannot see the Slido up here.
I didn't answer. So do we choose from the list or?
No, we cannot see the list up here.
Yeah, that's the thing, yeah.
What they say 1 second in the back. Okay, so the first priority that you see, promoting mental health in the young, addressing mental disorders, and promoting mental health in vulnerable groups, migrants and low income. So, do you agree to these?
Out of these, I would definitely choose as my priority mental health in the young.
Okay, Elke?
Me too.
You
and
too?
The third one.
Okay.
And the fourth one.
And the fourth one. Okay. And Ellen, can you see the Slido results? We may have lost Ellen. Okay. I'm afraid.
Yes, there was something with the sound.
Hello? I think we have.
Hello?
Yes, hello. Can you hear us? I think
yes, I can hear you.
Yeah, so can you see the Slido results?
I can see the results, yeah.
Yeah, so would you agree to these results as well?
Very much, very much. And also in terms of the priority 1, very, very recent evidence from the UK shows an increase in quite severe mental health conditions and also self-harm in children under the age of 12. So if we say the young, I think we have to be quite specific in terms of which specific age groups.
Thank you, and I'm afraid we are over time. This is a topic that we could talk about for hours because it's really so important for society. So, but I'm afraid we will have to conclude here. We will take stock of the input we have received and we will forward that for the development of the partnership. And thank you so much to the 3 participants, Tomislav, Elke and Ellen. Thank you so much for taking the time to be with us. And thank you to you in the audience for being here and paying attention to this important topic. Thank you.